Time for the injury report on the Pat and Aaron Show, presented by Florida Orthopaedic Institute in partnership with Tampa General Hospital, and welcoming this doctor back to the show. It's Dr. TTara Sonnanstine. Dr. Sonnanstine. So let's get right into it here. The Detroit Lions, their linebacker Alex Anzalone is dealing with a forearm injury. He's going to miss 6 to 8 weeks with a broken forearm. How common, I was just thinking about the forearm and what that would be, what that would feel like. How common are these forearm injuries?
Actually, the forearm injury to the radius bone is actually pretty common, but it's usually happening at the wrist. I'm not sure exactly where his fracture was, but to break your wrist, your radius is pretty common.
So aside from athletic injuries, you do see injuries like this quite often in just everyday life with normal people?
Yeah, definitely. With kids, we see it a lot, with older adults as well.
Do you think that Anzalone is going to be able to make a full recovery by the playoffs and be there for the Lions for the playoff run?
Yeah, if it's 6 to 8 weeks, yeah, I think he probably can if they're in the playoffs.
Yeah, and you look at the Jaguars and Gabe Davis, and he tore his meniscus, and their head coach Doug Peterson told reporters earlier in the week he's going to miss the rest of the season due to that torn meniscus. Just go through what a torn meniscus is and what that kind of feels like for people.
The meniscus is a piece of cartilage, C-shaped piece of cartilage that's in your knee. You actually have two, your medial and your lateral. So it's kind of a shock absorber for your knee. So if you do tear it, you do risk having that shock absorber being injured. So it can take actually, a good 6 weeks or so to heal, and that's without surgery. Depending on the type of tear, sometimes it does require surgery. That could take even longer to recover, sometimes 3 months or so.
We hear all the time, sometimes people, obviously athletes, they need their ACLs, but some people, they tear their ACLs and they're back on their feet and they don't really even have surgery for that. Is a meniscus similar to that, where like if you're not using it for athletics, you can kind of live through, maybe not a complete tear, but live through that injury a little bit?
Yeah, it definitely depends on the type of tear. But yeah, there are tears where you don't need surgery. You can treat it with physical therapy. And a lot of people are out there living with meniscus tears and they're doing fine.
Dr. Sonnanstine joining us right now, Florida Orthopaedic Institute in partnership with Tampa General Hospital. Can you tell us about the oblique? Because 49ers defensive end Nick Bosa is dealing with an oblique injury that occurred last week during a sack in the third quarter. What is that injury? What is the oblique?
So actually it's an abdominal muscle. You've got your internal obliques, your external obliques. It's a muscle that helps you twist and turn. So I'm not sure if he strained it or if he tore it. Sometimes if you tear your oblique, you're going to see some bruising, some bleeding. But if it's strained, sometimes you get some swelling, you get the pain. But yeah, it's an abdominal muscle.
There's some injuries that you hear that, stretching can really either avoid that injury or help avoid a real injury, knees and hamstrings and some of those things. What about with the oblique? I mean, I'm kind of fat, so I don't think I do oblique stretches, but is that a thing as well, or is that just kind of one of those injuries where, like, there's not a lot you can do to protect that area?
Yeah, there's kind of a balance between stretching. You don't want to overstretch, and then you also want to strengthen. So I think with the obliques, you want to have strong obliques. You do want to focus on strengthening those abdominal muscles.
Hold on a second. You don't want to overstretch?
You don't want to overstretch. You can actually overstretch muscles.
That's a possibility?
That's right. Yeah, oh, yeah.
Is that like, because people have told me you need to drink a lot of water, but don't drink too much water. Is it like one of those things?
Oh, yeah, everything in moderation, absolutely.
Oh, my gosh. See, I dive head first. Like, if I'm not drinking water for a while, I'll drink like 3 gallons of water. I guess that's just, I shouldn't be doing that anymore.
Yeah, not too much.
Nick Bosa did say, he told reporters he may have been overcompensating for the other injured hip. Is that possible? Well, what did he mean by that?
Well, he could have been trying to avoid activating his hip flexor muscles and then was relying more on his abdominal muscles. That could have led to his injury.
Speaking of hips, Dr. Sonnanstine, a lot of us, as we get older, we start to feel different things. We start to walk differently, and we hear about a lot of people getting hip replacements, and by the way, having great success with it, right? But I'm kind of curious, when should people, if they're feeling some different things when they're getting up and walking and moving around, middle-aged people like myself, I guess I wish I was middle-aged, but people that are getting a little bit older and starting to feel those things, when should they be worried that they might actually have a hip injury to the point where they might need a replacement?
So if they're having a lot of pain with weight bearing, if they're having trouble doing their normal daily activities, just walking, really it comes down to function. So if you're not able to function like you were before, if you've got arthritis that we see on your x-ray, that arthritis may be there, but it's really going to depend on how well you're functioning in your normal daily life. That's going to kind of tell you when it's time for hip replacement.
Jamal Dean, he He's returning to the Bucs after a month due to his hamstring injury. I know sometimes we'll hear 4 weeks, 6 weeks with the hamstrings. It's all different depending on who we're talking about. Should he be good to go if the Bucs are putting him back on the field? Should we not worry about this re-injuring moving forward?
He may have to, kind of keep that injury in mind. With hamstring injuries, it is a reoccurring injury that can happen once you've injured it once. So, yeah, I would advise him to be cautious with that.
Obviously, professional athletes, there's not a lot they can do to avoid the physical strain. They're going out there to play sports. But for the rest of us, if we were to have a hamstring injury at home, what's the best way to avoid re-injuring that if we still want to be active?
You want to make sure that you warm up before you do any sort of physical activity. Make sure the muscles are nice and warm, the blood flow is going.
But don't over-warm up.
Don't over-warm up. Yeah, don't exhaust yourself. And stretching for the hamstring is very important. So you do want to stretch those hamstrings. Most people have tight hamstrings. If you're planning on doing any sort of activity, just make sure you're warmed up, you're stretched out, and you're safe about it.
You brought something up that really stood out to me, arthritis. What does that feel like in your fingers? Because I'm starting to worry a little bit.
Oh, boy.
Oh, in your fingers, yeah. So you can get some stiffness, you can get some pain in the joint, sometimes even some swelling.
Yes, I have it.
Dr. Sonnanstine,
oh boy.
My co-host here is 33 years old.
34.
34 years old. Do you think potentially his biggest concern and worst injury might be to his brain?
Oh, to his brain? I don't know.
She hasn't been on with us enough, apparently.
Great stuff as always, Dr. TTara Sonnanstine. Thank you so much for joining us in the Pat and Aaron Show Injury Report, presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute, providing you access to one of the top orthopedic programs in the nation. Schedule an appointment today at floridaortho.com. Dr. Sonnanstine, thanks so much for joining us this morning. Great stuff.
Thank you so much.
Thanks, doctor.